I start with, I couldn't get out of a chair. I'm acting my age, and I turned 71 in March, so I was acting my age, and I said, yeah, this is not cool. I don't want, you can get older, but I don't want to be decrepit, and I don't want to be able to get up and out of a chair, and I couldn't do it. And I have my own business, so it's necessary that I stay vibrant and work 12-hour days and work with young people. So I had to take care of me, and that's what Dr. Curtis said when I first came to him. And he spent a couple of hours with me doing an assessment, and he said, how much time do you devote to yourself? And I said, honestly, none. He said, how much time are you willing to devote to yourself? And I said, well, you have to talk to my business partner, my Stephanie, my daughter, because she works me really hard. And so we met, and he asked her, and she was willing to give me 3 days a week, 2 hours, 3 days a week. Doesn't take that long, but she was willing to, and I did it, and I've been very consistent. It's slow progress, and there are things that, arthritis doesn't go away, but I certainly can move, and I have great range of motion, and I feel better, and I have so much energy. Plus, I can get out of a chair. That's very cool. And I'm also getting muscles. And the surprise benefit when I first started, brain fog diminished. I know, I didn't expect that, but brain fog diminished, and it was weird. So now if I have a momentary lapse, I stop and I think for a second, and then it comes back, comes to me, that was a nice side benefit. That was nice. Plus I'm losing weight, so that's kind of cool.
That's always good.
Yeah. Not overnight.
Yeah.
Not overnight. I was in the program, and I love the program because it's so comprehensive. And it's not, you don't have to be athletic. Because I work with football players and athletes, and they could do all these exercises and workouts, and at my age, and I have a sedentary job for the most part, that wasn't going to happen. But the adjustments, the stretching, the massage, it just all works together so that I can exercise, I can develop some strength and muscles, I can get out of a chair, I can sleep better at night, I can lose some weight and not feel sick all the time. It is amazing. Not overnight.
Hi, Dr. Chip Curtis. This is Jeannie. We're at All American Healthcare, and we're in our COVID masks. I'm going to introduce you to dry needling today. Jeannie's volunteered to demonstrate that technique. So what is dry needling? Dry needling is simply taking a needle and inserting that into trigger points. A trigger point is an area of muscle spasm that's due to local nerve irritation. And as we insert this needle into these muscle spasms or these trigger points, it helps bring blood flow to the area, it helps break up the adhesion, and really that's what dry needling is all about. We'll use it for things like tendonitis, muscle spasms, rotator cuff problems. It's really good for like tennis elbow, lateral epicondylitis, IT band syndrome, hip bursitis, or just general muscle spasms around the spine, neck, upper back, low back. All of those things are great when it comes to using the dry needling technique. Jeannie had a couple of treatments at dry needling with us, and I was asking her a little earlier how she felt after the dry needling. So I wanted you to go ahead and share that.
Yeah, so after I had the dry needling the last time, I felt very relaxed. I actually slept the entire night through. It was absolutely amazing. And I did notice a difference in muscle tension. So it was amazing.
Awesome. Okay, so we're just going to demonstrate how we do dry needling. Well, the area we're going to focus on for Jeannie is the upper back, neck area. The way that I was taught, some of the techniques do cross over toward acupuncture. There are some acupuncture points from a dry needling standpoint, we're going after muscle spasm, muscle tension. So I may do some areas where we are going after that muscle tension, but they do correspond to some of these acupuncture points. Now, while they're in there, Jeannie, what do you feel?
I actually don't feel really too much. Doesn't hurt or anything.
I don't know, loosened up already.
I was just gonna say I'm feeling so relaxed.
Okay, so one of the things you can see is the red spots. That's actually blood flow at the surface of the skin. So that's actually an area that's reacting, and to us, what that's showing us is that that area's got some tension in the area. The body is pushing blood to the area. That's things that we want, but it's also validating that there is tension in the area. A lot of times what will happen is these reaction spots, these red spots, you'll see them kind of flare up at first. Some will flare more than others, and you'll see the areas that are tighter, you can flare up even more. But as it starts to calm down, you can see those red spots start to go away. And then as people improve in general, you'll see less of a reaction as you go. Okay, so here we are about 6 to 10 minutes later, and you can see the difference in the reaction on Jeannie. So all we're gonna do now is go ahead and just pull the needles out. It's real simple. Jeannie, any discomfort as I do this?
No.
None whatsoever. Right, and that's pretty typical right there. And again, you can see how fine these guys are, hopefully against her little black sports bra there. Sometimes there's little blood vessels, little capillaries, so sometimes we may hit those. There can be a little touch of bleeding, maybe just a drop here or there. Just apply a little bit of pressure if we get any of that. And that's all there is to it. Okay, so Jeannie just got up from doing the dry needling. We wanted to ask her why she wanted to do dry needling. So
I wanted to do dry needling as an extension to my treatment plan here. I looked into it, did some research on it, and I think it was a very good decision.
So what we did is we actually took dry needling, and along with chiropractic care, part of treatment we do massage therapy, physical therapy, we're doing stretches and certain exercises to change the musculature in the area, and putting those kind of things together. From a dry needling standpoint, Jeannie's got a couple spots where they're really wicked trigger points. One of the techniques that we can do is basically to take the needle and go in there and try to help break up that trigger point. I didn't do that type of treatment today. If she wasn't responding, or if we had a person or an area that's really bad, like dealing with a rotator cuff issue, we can go in to break up those. It's not painful when that happens. You typically will get more of like a soreness type of response, but when we incorporate the massage and the stretching to go along with that, we find that people do so much better.
It's all for the better.
Hi, my name is Cindy Carboni, and I'm here to tell you that All American Healthcare and Dr. Curtis are #1 in my book. Why? Because my life has improved 100% since coming here. A little over a year ago, I couldn't walk, hardly at all, without pain because I had real bad arthritis in my knee. I had previously been to 2 orthopedic doctors with no relief. I came here as a result of a seminar with Dr. Curtis and went to a consultation. He told me that stem cells would help. He also told me about the ideal protein diet that they have here with Lanacable. I did both. Today, I can walk, I can work out at the gym, I can do anything. My family outings are much better now. I couldn't participate before, now I can. I'm so much happier. My body feels wonderful. Thank you, Dr. Curtis and Lanacable. and all the rest of the staff here at All American Healthcare.